So, ladies and gentlemen, with corrective orthodontics being braces, there's quite a number of components that are involved in treating such patients. Ne? So, with the wires that you guys see, there's a multitude of components that actually bring about braces as you know them into place. So the first thing we have are bands. Ne? So bands basically are stainless steel bands essentially that are placed around the posterior teeth. So they are basically used to anchor, and from there we can then control tooth movement. Okay, then from there, these are normally made out of stainless steel. We cement them in place using polycarboxylate or zinc phosphide or glass ionomers cement when the patient actually arrives. From there on, we have our buccal tubes. So normally with buccal tubes, they are sometimes welded onto or cemented onto our orthodontic bands. So they are normally buckled to the orthodontic bands, and they basically serve as an entry point for the arc wire to go through and actually bring about tooth movement. So that's basically how they get anchored onto those posterior teeth. And then from there we have our brackets. Our brackets are basically the little metal structures that we actually cement or bond directly onto the patient's teeth. So basically once they are then bonded, that is how then we take our arc wire from our posterior teeth and move them all the way up to our anterior teeth or around the arc. So they basically hold the wires. And then from there we have our arc wires. So arc wires are made out of a multitude of metals. Sometimes they're made out of stainless steel. So stainless steel is nice in that it is high strength, but then it is very susceptible to like movement. So that's when then we'll basically be making use of stainless steel. We also have braided wire. We also have nickel titanium, which is very resistant to deformation. And then they come in various sizes, these arc wires. They can either be round, rectangular, or square, depending on the type of movement or resistance that we are looking for. And then there's also a bunch of auxiliary as well as lingual attachments, but we'll get deeper into that as we go along. So fixed appliances, okay, also referred to as braces. Fixed appliances are a combination of bands, brackets, and auxiliaries that can move a tooth in 6 different directions. Interceptive orthodontics can move teeth in basically 2 directions. So either palatally, lingually, 4 palatally, lingually, mesially, and distally, but only to a certain extent. Okay, but these ones can actually bring about tooth movement in 6 directions. So that is mesial, distal, lingual, facial or buccal, apically, as well as occlusally. So those are the ones that now in interceptive orthodontics cannot do. So there's just a picture of braces. So as you guys can see, there are your brackets, and then there are wires in the maxilla and in the mandible running through and across the wires that we had basically mentioned earlier on. So arc wires, ladies and gentlemen, have 3 main shapes, or they take the form of 3 main shapes. They can either be round, rectangular, as well as square. So with our round wires, ladies and gentlemen, we basically use these at the initial treatment. So we're basically starting off with our treatment. So these are basically used to correct crowding, level the arc, open the bite, as well as close spaces. So yeah, I think that's self-explanatory. And then from there we have square or rectangular wires. These are basically used towards the end of treatment after multiple appointments, adjusting accordingly, checking if the tooth movement is how we wish for it to be. So with these wires, they are used to basically position the crown and the root in the correct maxillary and mandibular relationship. So that's how or what we use square and rectangular wires for. And then ligature ties, I've already explained ligature ties. So here they're just telling you that they're basically made out of stainless steel. So that's a 0.10 gauge stainless steel wire ligature, and that it is used to tie arc wires. I'm not going to go through that again. And then from there we have Kobayashi hooks. So ligature ties that have been spot welded at the tip to form a hook for the attachment of elastic. So now basically we would have taken a ligature wire and we would have actually made it into like the form of a hook, and then from there we basically going to use those to basically attach our elastics. Normally elastics are used to correct cross bites, as I had mentioned before. From there, ladies and gentlemen, we have our elastomeric ties. So these are basically the color essentially that you guys see that kids with braces normally have, and they keep changing. So that's basically those elastomeric ties. So they are small elastic rings that are stretched around the brackets. So you remember, brackets have ligature ties around them, so these elastomeric ties then actually keep everything in place. So they are placed around the bracket to hold the arc wire in place. I think I've explained that already. And they come in a variety of colors. So those the elastomeric ties are basically what keeps our corrective patients having hope. Yes, that's essentially what they do. From there, your slides talk about power products. So these would include elastic chain ties. So elastic chain ties are our continuous O's that basically form a chain, and they are used to close space between teeth or to correct rotated teeth. We then also have elastics. Elastics, ladies and gentlemen, they bring about a force of movement, essentially. They're quite important in orthodontics, and they're basically referred to as rubber bands, and they are placed normally between teeth or between arcs. So they can be placed within the same arc from one tooth to another, or in an opposing arc. So they help in closing spaces between teeth as well as correcting occlusal relationships. So that's basically the nice thing with elastics. And then from there, they talk about specialized instruments. So these basically help with separating, banding, bonding either our brackets or our bands, and then as well for debanding and bonding, and then again for arc wire forming, so that it actually takes the shape that we so desire. And then from there, specialized instruments for the removal and placement of our wires, hooks, brackets, ties, elastics, and everything else. Okay, so then from there they talk about adjustment visits. So with adjustment visits, we basically just checking for the appliance, are there any broken or missing arc wires, are there any broken or missing or lost ligature ties, and then we also check for our elastics, are you loose, are you broken, are you missing, things to that effect. So those are the things basically correct, as well as then sometimes even scaling and polishing and just maintaining the overall oral hygiene of the patient. So then from there, instructions are very important for you guys. You'll be giving your patients oral hygiene instructions, especially in orthodontic patients. The wiring and the brackets and all the bonding makes it very difficult for them to clean. So it's very important for you guys to actually go through those oral hygiene instructions. So with oral hygiene, ladies and gentlemen, we'll be talking about things such as brushing. So you'll be expected to show the patient how to brush. Some practices will actually have orthodontic brushes for them, so that you then basically show them how to get around all of their fixed appliances and all of their attachment, especially still maintaining the circular motions. But normally orthodontic brushes, they are designed to actually contour around the wires and get in between all those hard to reach areas. And then from there, you're basically going to encourage the patient that, look, after meals and before bedtime and in the morning, you have to brush to maintain your oral hygiene. This can be very difficult, but please keep instructing them. And then from there, flossing, sometimes you may have to tell the patient to buy a floss threader that just actually assists in getting the floss in between the arc wire and getting in between the proximal contacts. Tell the patient as well that they can actually buy proximal brushes that can assist to get into with between the interproximal areas, and actually encourage them to floss as often as possible, because normally flossing is like the main issue that they tend to struggle with. And then from there, fluoride rinses, those can actually be prescribed by the dentist to help maintain the patient's oral hygiene. We then also go to diet. So with diet, ladies and gentlemen, you will be telling the patient or instructing the patient not to eat anything hard, sticky, or crunchy, such as chewing gum, raw vegetables, unless they cut into smaller pieces. Things such as peanut butter, things to that effect. The patient will have to get off because they can compromise the wire or the elastics or even the ties that are actually in their mouth. And then from there, we're encouraging maintenance. So they must come for their appointments, for their checkups. Make sure that they're brushing as often as possible, making use of the rinse, making use of the floss, things to that effect, and reward them accordingly. Okay, and then most importantly, like how they mentioned here, please do not disappear, because obviously you have to show the patient the importance of the fact that if they do not come often to check the progress of those wires and those brackets and the corrective measures in place, it may actually even sever the progress that we are trying to achieve, and actually cause more harm to the patient as opposed to what we're actually aiming for with our treatment plan. So okay, oral hygiene instructions, like I said, NB. Okay, so toothbrushing instructions. So floss teeth using a floss threader or super floss. I mentioned that brush at least once every day. After brushing, rinse and swish water around to remove any debris, and then inspect teeth and braces carefully. Anything, even if it's a piece of food, try and take it out. Then from there are dietary habits and orthodontics. Please read through that slide and familiarize yourself with it, but I've already touched on dietary habits already. And then from there, ladies and gentlemen, your slides were actually at the end, they talk about retention. So retention can either be fixed or removable. So basically retention, ladies and gentlemen, is any appliance or any intervention that the orthodontist or the dentist uses to actually maintain the shape or the movements that we've achieved making use of our corrective appliances. Okay, so it can either be removable, such as Holy appliances, or even fixed. So sometimes they sometimes actually cement wires into place to actually ensure that the teeth do not relapse into their original position. So like I mentioned before, a Holy, something invisible, such as Invisalign or like an invisible retainer, those are quite popular. And then from there, the patient has to wait for at least 6 months or until growth has stopped. Okay, but sometimes recent studies have basically shown us that other patients unfortunately have to have like lifetime retention, otherwise the treatment or the success that we've achieved with the treatment may relapse. So there they're just showing you an example of a fixed retainer being a bonded lingual retainer. So that's basically a wire that was either cemented or bonded onto the lingual aspect of the teeth so that they do not retrocline or retrude to their original position. And then removable, a Holy retainer, love it for interceptive orthodontics. So yeah, that's basically one that a patient can actually just walk around throughout the day, but actually when they get home they can just pop it back in to make sure that their teeth do not lose the position. And then from there we have a positioner, as we had described before, as well as then invisible or clear retainers that are also quite popular because they're very aesthetic and the patient can actually keep them on even when they're actually going about their daily life activities. So yeah, oh, we've come to the end of that. I hope you guys enjoyed. I hope you've learned something. I hope you guys are watching, ne? I don't want you guys to see flames with your assignments or tests or exams. So I hope you guys are paying attention. Again, email me if you have questions. Comment below the videos if you are unclear about something. Guys, please do not keep quiet and be confused, and then you're going to get 2 practices and then you don't know what is going on. I think I've highlighted what is important, and then please just stick with it. And then from there I'm going to see what's happening with your other slides that I just need to discuss in terms of ortho. Okay, see you guys next time.